from WNYT, Albany, in HD. News Channel 13, live at noon, begins right now.
Coming up, what parents of student athletes can do to protect their kids from sports injuries this fall, especially concussions. When it comes to school sports, concussions aren't confined to the football field. Carla Pasquarelli is the coordinator of athletic training services at St. Mary's Healthcare, and she joins us now with some tips for concussion recovery. Before we start talking about recovery, let's go back to some of the numbers that I read, and the numbers are up, saying that accidents between adolescents is like the highest number.
It has, and I think a lot of that has to do with you see our professional sports becoming, I don't want to say becoming more aware, but putting it out there. You know, with all the rules with the NFL changing, and you see that being focused more in the NFL, you're seeing it trickle down to the littler kids and the high school kids, and we're getting more kids kind of becoming aware of what concussions are.
And so more kids are coming out for sports. I was looking at the numbers in soccer and football. Those are the numbers where the increase in injuries occur?
Yes, soccer and football are two of your most popular sports right now in America. And you think about how violent football can be and the collisions that occur in soccer. So with that comes the increase in head injuries.
And so if you think that your child may be suffering a concussion, what are some of the symptoms? What are you looking out for?
First of all, I tell parents, anytime you see your child take a hit to the head or a blow to the body which results in their head being forced back, that's number one. But then they start saying they have a headache, they're dizzy, they're nauseous, they start throwing up. You know, they're not themselves. One of the telltale signs I tell parents is, you know your kid's best. When you see that they've suffered some sort of hit and they're not acting right, chances are they probably have a concussion. Personality change is one of the biggest indicators.
So what do we do to prevent it? Because we were talking about this issue in the newsroom, and I said, well, if you're wearing a helmet, can you still get a concussion? And people were like, of course, yes, you can.
Yeah, it's the biggest misnomer out there, and I love it when the kids come in and say, well, I have a concussion-proof helmet. And I say to them, I laugh at them, I say, there's no such thing as a concussion-proof helmet. The helmet is going to protect you from a skull fracture, but your brain is still moving inside your skull. So the helmet's protecting the bone, it's not protecting the actual brain.
So what do you suggest?
Well, we tell our kids that they need to work on proper mechanics, proper, you know, and especially in football, proper tackling techniques, and don't hit with your head. Hit, you know, keep your head up. Don't lead with your head.
Okay. And you know, school's right around the corner, so these are some great tips. Carla Pasquarelli, we thank you so much for joining us.
Thank you.